Hello, welcome back to this channel. Today the topic of our video of pharmacology is syrups. So in this video we will learn about what are syrups, types of syrups, what are the components of syrups, preparation of syrups and aid of preparation of syrups. So what are syrups? Syrups are basically concentrated aqueous preparations of sugar or sugar substitute with or without flavoring agents and medicinal substances. Types of syrups include simple syrups, medicated syrups, and non-medicated syrups. Simple syrups. Simple syrups basically contain only sucrose and purified water. So simple syrups are basically saturated sugar solutions without flavors or any medical substances. Concentration of these syrups include, according to British Pharmacopoeia, it is 67.7% weight by weight, and according to United States Pharmacopoeia, it is 85% weight by volume. Next type of syrups is non-medicated syrups that contain flavoring agents but not medicinal substances. So these are non-medicated or flavored syrups. Uses of these syrups are to serve a pleasant tasting vehicle for medicinal substances to be added in the preparation of standard formula of medicated syrup. Examples of non-medicated syrups include cocoa syrup, orange syrup, raspberry syrup. In cocoa syrup, cocoa powder is in an aqueous vehicle sweetened and thickened with sucrose, liquid, glucose and glycerine, and it is then flavored with vanilla and sodium chloride. It is basically effective in administering bitter tasting drugs to children. Orange syrup. In orange syrup, sweet orange peel tincture is added in sucrose based syrups. Then it is a good vehicle for drugs stable in an acidic medium. Raspberry syrup. In raspberry syrup, raspberry juice is added in sucrose based syrup, and it is basically a pleasant flavored vehicle to diffuse the salty or sour taste of saline medicines. So the third and most important type of syrups is medicated syrups that contain the therapeutic agent or medicinal substances. Examples of these syrups include analgesics, anticholinergic, antiemetic, anticonvulsant, antihistamines, antiviral, antitussives, expectorants, bronchodilators, and fecal softeners. So what are the components of syrup? Syrups, in addition to purified water and medical agents, they include sugar, antimicrobial preservatives, flavorants, and colorants. In addition to these components, some syrups also contain special solvents, solubilizing agents, thickeners, or stabilizers. So the syrups can be sucrose containing and non-sucrose containing. Function of sucrose in syrups and its derivatives include sweetness, viscosity, flavoring agent, and masking the bitter taste. Most syrups contain high proportion of sucrose, basically 60 to 80%, that provide them desirable sweetness, viscosity, and also inherent stability to the syrups. When the medium is aqueous, it would dilute the sucrose in the syrup and would have an efficient nutrient medium for the growth of microorganisms. And while when the solution would be concentrated sugar solution, it would be resistant to microbial growth because water would be not be available for the growth of microorganisms. Also, the concentrated sugar solutions do not require any preservative if it is soon to be used. Preservatives are added if syrup has to be stored. So what are antimicrobial preservatives? As we discussed earlier, concentrated sugar solutions does not require any preservative if it is immediately used, and the amount of preservative that has to be added in the solution varies with the proportion of water that would be required for the growth of microorganisms. Most commonly used preservatives include benzoic acid, sodium benzoate, methyl propyl and butyl parabens, and alcohol. Preservation of syrups are basically done by three methods that include storage at low temperature, adding any preservatives in the formulation, and by maintenance of a high concentration of sucrose as a part of formulation. So what are flavorants in a syrup? Mostly the syrups are flavored with two methods: naturally occurring materials that include volatile oils, for example orange oil, and synthetic flavorants that include vanilla and others like this. The purpose of adding flavorants is to give a pleasant taste. So what are the colorants in a syrup? A coloring agent is basically added in the syrup to enhance the appeal of syrup. The colorant is generally water soluble, non-reactive with other syrup components, and its color would have to be stable if the pH change and the intensity of light change. Preparation of syrups. Syrups are basically prepared by one of the four methods or more than this one method that are listed here. These methods include solutions of ingredients with the aid of heat, solution of ingredient by agitation without the use of heat, or the simple admixture of liquid components, addition of sucrose to a prepared medicated liquid or to a flavored liquid, percolation of either the sucrose of medicated substances or of the sucrose. So the first method in preparation of syrups include solution with the aid of heat. This method is used when it is desired to prepare the syrups as quickly as possible. In this method, sugar is added to the purified water and heat is applied until the sugar is dissolved, and then the heat stable components are added to the hot syrup. Then the mixture is allowed to cool. Its volume is adjusted to the proper level by the addition of purified water. If heat labile agents or volatile substances has to be added in this solution, they are generally added to the syrup after the sugar is dissolved by heat, and then the solution is rapidly cooled to room temperature. What is invert syrup? When the heat is applied to the sugar solution, it would convert the solution of sugar and its certain components. Sucrose would be hydrolyzed to dextrose and fructose, and then the combination of these monosaccharide products would be invert sugar, and the syrup containing the mixture of glucose and fructose would be termed as invert syrup. Advantage of this syrup is it would be more sweet than simple syrup, and disadvantage include it would be more susceptible to fermentation and microbial growth. Normally it would be colorless and would darken because the effect of heat on fructose portion of invert sugar. Some precautions need to be taken while preparation of syrup that include, because heat is would decompose the syrup, so syrups cannot be sterilized by autoclaving. Also, the use of boiled purified water in the preparation of syrup can enhance its permanency, while the addition of preservative agent when permitted can protect it during its shelf life, and storage would be required in a tight container. So the second method in preparation of syrup is solution by agitation without the aid of heat, that is used to avoid heat induced inversion of syrups. In this method, sucrose and other formulative agents are placed in a larger vessel and then they are dissolved in a purified water. This process is more time consuming than the use of heat, but the product's stability would be maintained in this process. Huge glass-lined or stainless steel tanks with mechanical stirrers or agitators are employed in large-scale preparations of syrups by this method. When solid agents are to be added to the syrup, it is best to dissolve them in a minimal amount of purified water and incorporate the resulting solution into the syrup. Third method in the preparation of syrup is addition of sucrose to a medicated liquid or to a flavored liquid. A medicated liquid such as tincture or fluid extract is employed as a source of medication in the preparation of syrup. Many such tinctures and fluid extracts contain alcohol-soluble constituents and are prepared with alcoholic or hydroalcoholic vehicles. If alcohol-soluble components are desired medicinal agents, then this method is not applicable. However, if alcohol-soluble components are undesirable, they are generally removed by mixing the tincture or fluid extract with water, allowing the mixture to stand until the separation of water insoluble component and filter them from the mixture. Then the filtrate would be medicated liquid to which sucrose is added. If tincture or fluid extract is miscible with aqueous preparations, it may be directly added to simple syrup or to flavored syrup. So the last method in the preparation of syrup include percolation. In percolation method, there are two possibilities. First is sucrose may be percolated to prepare the syrup, in which first a sucrose bed is prepared and then water or vehicle containing therapeutic agent is passed through this bed. Second possibility is the source of medicinal component may be percolated and would form an extractive to which sucrose or syrup may be added. This is done by two procedures that include preparation of extractive of the drug and preparation of syrup. Packaging of syrup. Syrups are basically pharmaceutical products, so they require safe, secure and tamper-proof handling. Packaging would ensure complete protection from contamination of microbial growth and would ensure their extended shelf life. The general procedure of packaging include filling, sealing, capping, coding and labeling, and wrapping. The steps in the packaging include: first, the empty bottles are rinsed through air jet cleaning. After complete cleaning, bottles are tested and transferred ahead for filling. Filling machine with their automatic piston fills the bottle with accurate volume of syrup, and then capping is done on the bottles through capping machine. Plastic or aluminium capsules are bound over the neck of bottle for secure sealing. Then the important details regarding packaging date and expiry date are printed on the bottle. After packaging, every pharmaceutical preparation or product would be labeled when it has to be dispensed or sold to the patient, because it would convey essential information to the patient on the use of this preparation. After labeling, the pharmaceutical preparation has to be stored that require some form of additional instructions to be detailed on label. This information can be the addition of just a product expiry date through to a number of important additional label. So what are the advantages of syrup? Advantages of syrups include: they are appropriate for any patient whatever the age is. They are most natural and easiest route of administration. This is the economical and safe to use. No nursing is required, that means patient can itself take. The liquid dosage form is expected for certain types of products like cough medicines. Disadvantages of syrups include: they would have a delayed onset of action because absorption time would be slow. So they are not suitable in emergency situations and for unconscious patients, and also not suitable if the patient is having diarrhea, ulceration and nausea, because oral route would not be suitable in that case. And also this is the oral route, so they would undergo first pass effect that would alter their medical properties also. Thank you for watching this lecture. Stay tuned for upcoming lectures of general pharmacology.